Hello everyone and welcome to Student Homeopathy. If you are a BHMS student or passionate about learning homeopathy, you have come to right place. In this series, we are going to study homeopathic materia medica in alphabetical order, making it easy to understand, remember and revise. We will learn each medicine from classical text of Kane's lectures on homeopathic materia medica and Allen's keynote, focusing on the most important exam points, keynote, clinical hints, memory trick and remedy comparison. We will begin with the letter A, and in this video we will cover the first 10 remedies. First, Abies canadensis. Second, Abies nigra. Third, Abrotanum. Fourth, Absinthium. Fifth, Acacia arabica. Sixth, acetic acid. 7. Acetanilidium. 8. Acetylcholinum. 9. Achillea millefolium. And 10. Aconitum napellus. Each video will be short, simple and packed with high-yield information for BHMS University exam, viva, NEET PG and clinical practice. So if you don't want to miss any remedy, subscribe to Student Homeopathy, like this video and share it with your friends. Now let's begin our A to Z materia medica journey with our very first remedy, Abies canadensis. Our first remedy is Abies canadensis, commonly known as hemlock spruce. The grand keynote of this remedy is ravenous appetite with weak digestion. The patient feels constantly hungry, yet even a small meal causes heaviness, fullness and gastric discomfort. In simple words, hungry but cannot digest. According to Allen's keynote, there is a sensation as if the stomach is weak or empty, with craving for coarse food, meat, pickles and radishes. Flatulence and abdominal bloating after eating are common features. Kent emphasizes that this remedy suits patients with chronic dyspepsia and poor digestion, especially when the digestive system feels exhausted after meal. Another important indication is in women with a feeling that the uterus is weak or displaced associated with pelvic weakness. Memory trick: always hungry, never digest. This one line is enough to remember Abies canadensis for your exam. Example: whenever you see ravenous appetite with poor digestion and fullness after eating, think of Abies canadensis. Now let's move to our second remedy, Abies nigra, also known as black spruce. The grand keynote of Abies nigra is sensation of hard boiled egg or lump lodged in the stomach, especially after eating. This peculiar symptom is one of the most important exam points from Allen's keynote. According to Kane, this remedy is especially suited to elderly people with chronic indigestion. Even a light meal causes heaviness, pain, and the feeling that the food has remained undigested in the stomach for hours. The patient often has slow digestion, constipation, and distress after meals, with discomfort centered in the stomach region. Memory trick: a hard boiled egg stuck in the stomach is Abies nigra. Example: whenever you find the peculiar symptom feels like a hard boiled egg or lump in the stomach after eating, immediately think of Abies nigra. The next remedy is Abrotanum, a famous medicine known for marasmus and peculiar symptoms of metastasis of disease. Now let's continue with our third remedy, Abrotanum, commonly known as southern oat. The grand keynote of Abrotanum is marasmus with ravenous appetite. The patient eats well, sometimes excessively, yet continue to lose weight and become weak. This is one of the most important points emphasized in Allen's keynote. According to Kane, Abrotanum is a remedy of metastasis. When one disease disappears and another develops, a classic example of rheumatism disappearing followed by diarrhea, or the reverse. This alternating pattern is a key indication. Children needing Abrotanum are often thin, emaciated, weak and irritable, especially in the lower limbs despite having good appetite. Memory trick. Eats a lot, loses a lot equals to Abrotanum. Example. Think of Abrotanum whenever you see marasmus with good appetite or metastasis of disease, especially the alternation between rheumatism and the diarrhea. In the next remedy, we will study Absinthium, well known for its action on the nervous system, convulsion and hallucination. Now let's move to our fourth remedy, Absinthium, commonly known as wormwood. The grand keynote of Absinthium is its powerful action on nervous system, especially in the patient with convulsions, epilepsy and mental excitement. According to Allen's keynote, the patient may experience sudden convulsion followed by unconsciousness along with hallucination, delirium and the confusion. They may not remember what happened after the attack. Can describe absinthium as a remedy for violent nervous symptoms where there is a great restlessness, dizziness, trembling and the loss of memory after seizures. Memory trick. Convulsion plus hallucination is absinthium. Example, whenever you see epileptic convulsions with delirium, hallucination or loss of memory after the attack, think of absinthium. Now let's continue with our fifth remedy, Acacia arabica, commonly known as babul or gum arabic tea. Acacia arabica is a less frequently used remedy, but it has important keynote in dental and gum disorders. According to Allen's keynote, it is useful when the gums are swollen, spongy, bleeding and painful with loosening of the teeth. There may also be ulceration of the mouth and offensive odor. Kent gives comparatively little emphasis to this remedy, but the characteristic action is on the mouth and gums, especially in chronic inflammatory condition. Memory trick. Bleeding gums is equal to Acacia arabica. Example, whenever you find spongy bleeding gums with loose teeth and mouth ulceration, think of Acacia arabica. Now let's move to our sixth remedy, acetic acid, also known as Acidium aceticum. The grand keynote of acetic acid is profound weakness with marked anemia and rapid emaciation. The patient becomes pale, exhausted and lose weight despite adequate nutrition. According to Allen's keynote, there is an intense thirst for large quantity of cold water along with pale waxy appearance. It is also traditionally described in cases with profuse bleeding, dropsical swelling that is edema and great debility. Kent emphasizes the picture of collapse and exhaustion where the vital power seems great. Now let's continue with our seventh remedy, acetanilidium. The grand keynote of acetanilidium is collapse with cyanosis. The patients become cold, weak, pale and bluish. Indication poor oxygenation and circulatory depression. According to Allen's keynote, there is a marked cyanosis and cold sweat, weak pulse, dizziness and extreme prostration. The face, lips and nails may appear blue and the body temperature may fall below normal. Kane describes it as a remedy for collapsed state, where the patient is exhausted, drowsy and the circulation is greatly depressed. Memory trick. Blue, cold, collapse equals to acetanilidium. Example, whenever you see cyanosis with collapse, cold skin, weak pulse and profound prostration, think about acetanilidium. Now let's move to our eighth remedy, Acetylcholine. The grand keynote of acetylcholine is overactivity of the parasympathetic nervous system. It affects smooth muscles and glands, producing increased secretion and spasmodic symptoms. According to classical Materia Medica, the patient may have profuse salivation, excessive sweating, increased tear secretion, intestinal cramps, diarrhea, bronchial spasm, and the slow pulse. Unlike many major polychrests, Kent and Allen do not discuss acetylcholine in detail, as it was introduced later in homeopathic literature. Therefore, exam questions usually focus on its psychological action rather than extensive keynote symptoms. Memory trick: weight, slow, and spasmodic equals to acetylcholine. Examples: think of acetylcholine whenever you see increased secretion, smooth muscles spasm, bronchoconstrictions, diarrhea, and bradycardia, reflecting parasympathetic stimulation. Now let's continue with our ninth remedy, Achillea millefolium, commonly known as yarrow. The grand keynote of Achillea millefolium is profuse bright red hemorrhage. It is one of the classical remedy for bleeding after injury, strain, or stoma, especially when the blood is bright red and flows freely. According to Allen's keynote, Achillea is especially useful for epistaxis, that is nosebleed, hemoptysis, bleeding from the lungs, uterus, or bowels, and other forms of active hemorrhage. The patient may become weak due to blood loss, but the bleeding itself is the most striking feature. Kent emphasizes its value in hemorrhagic condition, particularly when the bleeding follows a fall, overexertion, or physical injury. Memory trick: bright red bleeding is equal to Achillea. Example: whenever you see profuse, painless, bright red bleeding, especially after injury or strain, think of Achillea millefolium. Now let's finish today's video with our 10th remedy, Aconitum napellus, one of the most important remedy in the homeopathic Materia Medica. The grand keynote of aconite is sudden onset. Symptoms appear suddenly after exposure to cold, dry wind, fright, or a shock. According to Allen's keynote, the patient has intense fear, anxiety, and restlessness, often with fear of death. They may even predict the exact time they think they will die. This mental picture is the hallmark of aconite. Kent emphasizes that aconite is a remedy for the first stage of acute inflammation before structural changes occurs. It is commonly associated with high fever, hot dry skin, a full rapid pulse, and extreme thirst. Memory trick: sudden fear and fever is equals to aconite. Example: whenever you see a sudden illness after cold, dry wind, or fright with high fever, restlessness, and fear of death, think immediately of Aconitum napellus. And that's the first 10 remedies of letter A. Revise these keynotes regularly. They are frequently asked in BHMS exams and viva. In the next video, we will continue our alphabetical Materia Medica journey with the next set of A remedies. Don't forget to like, subscribe, and share this series with your classmate, and see you in next lesson.